Are all vaginal discharge white?
Okay. It's very funny that a lot of women think that any form of vaginal discharge that they see is due to white, what we call candidiasis, right? Now, it's important to understand that the body is designed to actually have discharge. So there is normal vaginal discharge, which is clear, it is thin, it is odorless, okay, or has a pleasant odor, to put it. Yes. So your body has this discharge. It helps to lubricate the area. It helps to protect against infections. Okay, it helps to moisturize the place and just keep it healthy or hygienic, to say. However, there are some types of discharges that we deem as abnormal vaginal discharge. And these discharges are usually either due to hormonal imbalances, they can be due to sexually transmitted infections, or they can just be due to a disruption in the pH in the vagina. So the vagina has an acidic pH, which is designed in such a way that it can fight infections, right? So if you take something like the white or the candidiasis that we are talking about, when there is an overgrowth of, it's a fungus, it's not a bacteria, it's a fungus, okay, which causes the candidiasis. We call it Candida albicans, right? So if Candida albicans overgrows in the vagina, then it leads to the candidiasis. And these people usually have a classic type of discharge. It is not any discharge that is candidiasis. Their discharge is usually very thick. It looks like cheese. So we call it the classic cottage cheese-like appearance, right? So, and then they'll have a lot of vaginal itching as well. Sometimes the vagina, the area will become reddened because of maybe the scratching here and there. So if you see discharge which is thick, which is creamy, which looks like cheese, okay, then you are suspecting that it's most likely candidiasis. But it's always important to have it checked. Then there are some discharges that look yellowish and they may look a little thinner than the candida. And these ones are usually caused by bacteria, which we call bacterial vaginosis, right? So bacterial vaginosis is just, again, an overgrowth of bacteria in the vagina. So like I said, the vagina itself has some microorganisms which keep it in place. An example is what we call lactobacillus, which is there to maintain the pH, fight infections and all that. But you can have an overgrowth of this bacteria and then it can lead to infection, something like the bacterial vaginosis, where they will have the yellowish discharge, which is thin. You will have some burning sensation. It can also come with some itching as well. Then the other one I'll talk about is the one that is caused by another microorganism with a big name. We call it trichomoniasis, okay? So for trichomoniasis, they would have data has shown that sometimes trichomoniasis can actually be sexually transmitted, but it is not entirely a sexually transmitted infection. You can get it outside of sexual activity as well. So for trichomoniasis, what happens is they would have, again, a yellowish discharge, but it has like a greenish tint to it. So yellowish green discharge, which is thicker than what you see in the bacterial vaginosis. It also comes with the burning sensation and all that. Now, because these are infections, for all of them, the person who is affected can have a fever, which is their body begins to become hot or warm, right? They may not be able to eat well. They may have nausea, vomiting, some other symptoms that come with infections. So again, it's important. If you think you have white, which is Candida albicans, please, the cure is not antibiotics. Because when I mentioned it, I said Candida is caused by a fungus or fungi. And if you take antibiotics for fungus, it is not going to do anything. So the ladies who will go to the pharmacy and say, oh, I want Flagyl or I want Cipro, just because you've heard the names of these antibiotics and you go and buy them for white, it is not going to work because it is a fungal infection. So you fight it with antifungals, okay? So if you are not sure what antifungal to get, that's why it's important to come to the hospital. Because first of all, you may not know if it is Candida, if it is bacterial vaginosis, if it is trichomoniasis, or if it is another STI like maybe gonorrhea or chlamydia. They all come with some discharge as well. So you want to come to us and have it checked out. And if we think it is white or candida, we will give you antifungals to cure your whites. Yeah, basically. I hope that answers your question.